Monkeypox update. Monkeypox has become a topic of concern worldwide. Its rapid mutations have worried many healthcare professionals as they fear this will get worse. Currently, the overall risk of monkeypox is assessed as a moderate global health emergency. In areas where the outbreak is prevalent, the concern is, obviously, greater. As of January 1, 2022, a total of 4,723 laboratory-confirmed cases and 1 death have been reported. Healthcare professionals agree that there are probably many more that go unreported. Of the cases, 86% of the total cases confirmed by the WHO were located in Europe. 11% of the cases are in the Americas. 2% of the cases are from Africa, and the remaining cases are from the Mediterranean and the Western Pacific region. Here is an image from the WHO showing the monkeypox cases between January 1st and June 22nd, 2022. The Center for Disease Control and the World Health Organization are working to control the viral outbreaks, educate, and to understand all it can about this virus. Here are some bullet points that you need to know. The CDC is tracking an outbreak of monkeypox that has spread across several countries that don't normally report monkeypox, including the United States. The monkeypox virus is spreading mostly through close, intimate contact with someone who has monkeypox. You can take steps to prevent getting monkeypox and lower your risk during sex. CDC recommends vaccination for people who have been exposed to monkeypox and people who are at higher risk of being exposed to monkeypox. If you have any symptoms of monkeypox, talk to your healthcare provider, even if you don't think you had contact with someone who has monkeypox. CDC is urging healthcare providers in the United States to be alert for patients who have rash illnesses that may be consistent with monkeypox. To date, the monkeypox routes of transmission include human-to-human contact, via direct contact with infectious skin, lesions, or respiratory droplets. There is also danger from indirect contact from contaminated objects or materials, such as feces or bodily fluids. Monkeypox is known to be spread during pregnancy, from mother to child via the placenta. Regarding sexual transmission, it is still unknown if it is transmitted via semen or vaginal fluids, but the close physical contact and sharing of respiratory droplets is a danger. What is so remarkable about the current strain of monkeypox lies in the signs and symptoms. The clinical presentation is different from previous strains. The current infections are not presenting as the classically described clinical picture of monkeypox. Historically, monkeypox infections have suffered from fever, swollen lymph nodes, followed by centrifugal rash. But the current symptoms are different, diverse, and include presentation of only a few or even just a single lesion. Absence of skin lesions in some cases, with anal pain and bleeding. Lesions in the genital or perineal or perianal area which do not spread further. Lesions appearing at different, asynchronous, stages of development. The appearance of lesions before the onset of fever, malaise, and other constitutional symptoms with the absence of prodromal period. The fever and swelling are not always present in some infections. Here's what the CDC is doing. The Center for Disease Control is educating and assisting state, local, tribal, and territorial health departments with identification of cases as well as tracking information to slow the spread. The CDC have increased their testing and are expanding access to their orthopoxvirus tests for commercial lab use, increasing testing capacity and making it easier and more accessible. In order to overcome this outbreak, information is key. They are seeking to understand the origin, effects of the outbreak, and its method of spread. The information that is gathered is being shared around the globe. The CDC is collaborating and consulting with other countries experiencing monkeypox, trying to understand its evolution and how to control the outbreak. The CDC have identified certain communities in danger. Many, though not all, of the reported monkeypox cases have been among gay, bisexual, and other men who have sex with men. Given this, CDC has emphasized the need to identify and use specific channels to promote messages that directly reach gay and bisexual men across racial, ethnic, socioeconomic, and geographic backgrounds. Once the communities have been identified, action can be taken to inform them on how to prevent and control this disease. The CDC also keeps up-to-date information on their website. It is important to reduce stigma associated with the virus. This virus can be caught by anyone, it just so happens that the communities in danger are a minority. Prevention and control are only one part of the picture, however. Vaccines and therapies are being utilized to better protect the population. Vaccines are being prioritized for areas that are being impacted the greatest, first. And by providing guidance to state, tribal, local, and territorial health officials to aid their planning and response efforts. Because of limited quantities, the CDC is only vaccinating people who are at the greatest risk for exposure or severe illness. Treatments are available for monkeypox. Tecovirimat is the antiviral drug of choice. It has been approved by the European Medicines Agency for orthopoxvirus-associated infections, including monkeypox. It is a smallpox vaccine that treats monkeypox because it is a similar type of virus. This information is based on animal testing. This is then applied to the human models so as thought to be safe. Regarding travel, there are currently no limitations on travel. Overall, it is increased contact tracing, education, destigmatization, vaccinations, and therapies that will clear the way from this outbreak. That is all for this current update. Thank you for watching. Please like and subscribe. Take care and be well.